Network, otherwise known as OCHN, is the public mental health system for Oakland County. You may have heard us being called CMH in the past before we changed our name. We are community-based, and we're a local public entity that manages specialty support and services. We serve adults with mental illness, children with serious emotional disturbances, children and adults with intellectual and developmental disabilities. We do infant mental health work, and we also serve children and adults with substance use disorders. So we serve quite a lot of people. The total that we are currently serving is about 26,000 people, and our adult mental illness population is 12,700. We serve children with autism, 240 of those are children with autism. 2,400 are children with serious emotional disturbances. 4,200 have intellectual or developmental disabilities, and 7,300 have some type of substance use disorder. Our mission is to inspire hope, empower people, and strengthen communities. So OCHN is what's called a PIHP and a CMHSP. It can get slightly confusing, so we're going to kind of break that down a little bit for you. So PIHP stands for Prepaid Inpatient Health Plan. There's only 10 of them in the state of Michigan, and a couple slides later we're going to show you kind of how that looks. What a prepaid inpatient health plan is that we are responsible for managing the services related to behavioral health, developmental disabilities, and substance use disorders for Michigan, for Oakland County. We are what's called the safety net. So we're under contract with the state, so MDHHS, they give us funding, they prepay us every month funding to serve the people that are in Oakland County. We are also responsible for arranging inpatient care. So anyone that is in crisis or needs to have inpatient care that has Medicaid or has no insurance, we authorize and provide that service. We are also what's known as a CMHSP, Community Mental Health Service Program. So we actually provide services and support to people directly or through contracts. In Oakland County, we do both. We have core providers that serve folks, but we also do some direct services here. We are governed by a board of directors, and the CMHSPs across the state are managed by a PIHP. So Oakland is unique. There's only 3 counties that are both CMHSPs and PIHPs. Now, the Oakland, Macomb, and Wayne, because we're very large. The rest of the 10 PIHPs cover many different counties. So we're fully accountable to governmental entities. We ensure that they have public participation. Folks have that decision making in our system. Any money that we save in our system of care gets reinvested back into the system, which makes us unique to private health entities. So this is a diagram. It kind of shows you on the left, it talks about the CMHSPs. There are 46. Many CMHSPs are counties, and they range in size. You can see Oakland, Wayne, Macomb down there. You can see how the UP has 5 different CMHSPs. And then when you look on the right, the PIHP, it tells you which PIHP governs which CMHSP. So for example, North Care Network, which is Region 1, they cover the entire UP. And they only have 5 CMHSPs within that, but it's a very large amount of territory they cover. So that list is the 10 different PIHPs. Oakland, Wayne, and Macomb, which is 7, 8, and 9, we are the only ones that are single county PIHPs. And then there's multiple PIHPs that have 7, 9, 10 counties or CMHSPs within it. So it's a very interesting how the state of Michigan is broken up. Okay, so funding and delivery is important to understand. The funding comes from the Michigan Department of Health and Human Services. We also get some local funds from the county, and the local funds that we get really go towards jail programs and community benefits. So the money comes into OCHN, and from that, we have core providers that we contract with to serve all the populations. We fund money for them, they serve their populations, and then we also have contracts with direct service providers. Those would be like PLS workers, respite care workers, our group homes, things like that. And then that goes right to delivery to the people that we serve. I'm going to hand it over to Jody now to talk more about the basics of mental health.
Okay, thank you, Jasmine, and good morning again, everybody. So we're going to start talking about some just basic definitions. So mental illness is a condition that affects an individual's mood, thinking, feeling, or behavior. It can cause an individual to feel distress and have difficulty performing usual functions. So we're talking right now about a gamut of functions, things such as brushing your teeth, something as simple as shaking someone's hand, or even doing something like going to the grocery store. Mental illness has a lot of outward symptoms and presentations, and we are going to talk about those in the next slide, and we'll get a little bit more into that. We have to talk about substance use, even though this particular webinar is focused on mental health, and a subsequent webinar is going to be focused on substance use disorders. But we have to talk about that briefly while we're here, because we know that it co-occurs so frequently in individuals with mental health disorders. So substance use disorder is a disease that affects a person's brain and behavior and leads to an inability to control the use of illegal drugs, legal or illegal drugs or medications. And I think the medications part is really relevant to what you all do on a daily basis. And it really has to be discussed because, as we all know, substance use disorders don't always start with an individual using cocaine or methamphetamines or going right to heroin, etc. So substance use disorders can start with the medications that our doctors give us for any number of ailments. Addiction is defined as a disease involving interactions among brain circuits, genetics, environment, and individual life experiences. People with addiction use substances or engage in behaviors that become compulsive, and as we know, they often continue to use despite the number of harmful consequences that come into their life as a result. The prevention, and this part is really important, prevention efforts and treatment approaches for addiction are generally as successful as those for other chronic diseases, and this comes directly from ASAM, the American Society of Addiction Medicine. And it's really important to talk about this because we often have this idea that substance use disorders cannot be treated. And we hear things all the time. We hear things about drug addicts or junkies. And we hear things like individuals that are addicted to substances or have a substance use disorder are losers, or the world would be better off without them if they just overdosed and died. But we wouldn't say that about an individual that has cancer or heart disease or multiple sclerosis or any number of other medical ailments, because we believe in treatment and modern medicine. Well, at Oakland Community Health Network, we believe in treatment for individuals with substance use disorders, and this is what we do. And part of what we do is also substance use disorder treatment in different modalities. And again, the subsequent webinar on substance use disorders will talk more about it. But we know that treatment for substance use disorders can be successful, and we've seen it firsthand in the provision of services to individuals with substance use disorders. So what does mental health look like? This is kind of like right here on the front lines of what you all are doing every day, seeing people in the courtroom, seeing people in your office, seeing people in the lobby, meeting them in the community. We're going to talk about some common mental health disorders that you heard of. Anxiety or generalized anxiety disorder. You may have heard of attention deficit disorder or ADD, or also attention deficit hyperactivity disorder, which is ADHD. Schizophrenia, bipolar disorder, dementia is a mental health disorder, depression or major depressive disorder, and post-traumatic stress disorder. Obviously, we didn't include every mental health disorder that you may have heard of, and you may come in contact with individuals who report suffering from mental illnesses or having diagnoses that aren't listed here. And that can happen because there's so many of them. So what might you see or notice? And this is really, really important because what we see in an individual is really what is the underlying factors of what they have going on in their lives. And oftentimes we mistake certain things for other things, and we don't consider the fact that individuals might have a mental illness. So some observations that you might see for individuals who are there with you, again, in the courtroom, in your office, in the lobby, in the community, trembling or shaking, sadness or a depressed mood. You know, this can include things like flat affect. The individual might report that they don't have any joy in their lives. They might tell you it's hard to get out of bed in the morning, or they feel like they wish they just wouldn't wake up. Confusion, memory loss. Sometimes individuals with mental health disorders obviously hear voices, or they have visions. They will maybe report racing thoughts or thinking the same things over and over and over again. Paranoia, they might talk about things that you know are not true. And this one I think is a big one, which is failure to understand proceedings. So having worked myself in the criminal justice system for 10 years, I feel like I saw this so many times. The justice system can be really confusing for anyone, even those without mental health disorders. So it's important to remember that confusion or failure to understand what's going on in the court or in your office or what you're seeing in front of you, it actually could be a sign of mental illness, and more exploration of that might be necessary. It doesn't necessarily mean it's simply a behavioral issue or they're just behaving badly, but it could mean that more exploration is necessary. So some behaviors you might see are individuals who maybe are unable to sit still, they're bouncing their knees, they're wringing their hands, individuals who respond inappropriately. And for those of you obviously who work in a courtroom setting, you see this all the time, every day, with individuals who respond inappropriately. It doesn't mean that they necessarily have a mental illness, but they absolutely could have a mental illness. So things like they're laughing, they're crying, they're acting happy when they get sentenced to jail, things that seem very inappropriate for the situation that they're in at the moment. They might act belligerent or disrespectful. And I know we've all seen this, which is individuals who are swearing or possibly using racial slurs or speaking out of turn, maybe when the judge is speaking or when you're speaking. An individual might be high-spirited. They might have poor hygiene, and hygiene is a huge one. Looking for that, that's a really big indicator, can often be a really big indicator of individuals with mental health disorders. They might be wearing unsuitable attire. They might be talking to themselves, and they might fail to make eye contact. The failure to make eye contact is especially typical of autism spectrum disorders. So an individual might not be being disrespectful or rude, but it might actually be an indicator of an underlying mental health disorder. And sometimes individuals will express bizarre thoughts or ideas. So I want to talk a little bit about stigma, because stigma is super huge in what we do here at Oakland Community Health Network and what we talk about all the time. And what we're always working towards is educating people and training people and trying to help them understand what stigma is, what it means, and what it does to individuals. So stigma is a mark of disgrace felt by many individuals with mental health disorders. And honestly, you can think of it as shame or embarrassment as well. Stigma leads to labeling, and labels can be hurtful, as we all know. And labeling is really, really common for individuals with mental health disorders. And you may have heard people talk about individuals with mental health disorders as being crazy or a nutcase or Looney Tunes. Or when it comes to substance use disorders, you might hear things like junkie or druggie, or again, loser. And we know that when we label people these things, that this leads to prejudice, and prejudice leads to discrimination in everyday lives. So there's often this belief that individuals with mental health disorders, that they're not treatable, that they're difficult, that they're not smart or they are incapable of making decisions on their own behalf. And that could not be further from the truth. Mental health does not mean that you're unintelligent or that you shouldn't have the same rights as everyone else. Stigma can lead, and it really does lead to abuse, rejection, and isolation. And that's in the criminal justice system and just outside in the everyday world. And it can result in the exclusion of individuals from healthcare and community supports. Individuals are excluded either because they're too embarrassed or ashamed, or because that's the way that the systematic pressures have been put upon them. So at Open Community Health Network, we're really focused and committed to an anti-stigma campaign. And if you ever come to any of our trainings or you see any of the rest of our webinars or anything we have going on, you will see this coming up over and over again. We use person-first language, and we really strongly feel that people are not their diagnosis. They have bipolar disorder. An individual can experience depression. They may have a developmental disability, or they have a substance use disorder. So before I hand it back over to Jasmine, I want to talk really quickly about privacy of health information. And this is really, really important for what you all do, and especially with your work with us and with our liaisons and really anybody, our Access Center and anybody that you have contact with here at our agency. So all the individuals that are served by us, Open Community Health Network, and our providers, they're protected under HIPAA and 42 CFR, which is the Code of Federal Regulations. And HIPAA stands for the Health Insurance Portability and Accountability Act. It's something you hear all the time. I don't know if anybody ever tells you what it stands for. It's a little confusing, and I'm just going to talk about it briefly, what HIPAA exactly means. But basically, both of them are federal laws that tell providers and others how they can share an individual's health information, and that includes mental health or behavioral health information. So HIPAA, what you hear, I'm sure, a whole lot of times, that was established in 1996, and among all of its many functions, it establishes safeguards to ensure privacy of an individual's protected health information. And just honestly, protected health information is things simple demographic data and their medical history and their test results. So things like their name, their date of birth, their address, if that can identify them, then that is considered protected health information. So what HIPAA has 4 parts, and I won't go into detail about them, but what really it protects exactly is an individual's health information. It covers the security of electronic records. It tells us how we're allowed to share records electronically. And that actually comes into play when we have an individual or a liaison or Access Center is working with someone that you have referred for services, because we have to share the information properly as far as electronic communications. Sometimes this comes into play with release of information and how we are able to do that. There are times when a probation officer or a parole agent might want to take a photograph of a release of information that they just have signed and send it to me that way. And we don't accept that. So we accept scanned copies. And I know that's not always necessarily easy in your office, but again, we have to abide by the rules of HIPAA and what it covers. It also talks about insurance portability, which means that basically an individual has to have the guarantee of health insurance, and for those individuals also who wouldn't normally qualify due to their health status. And it also, HIPAA talks about administrative simplification. So even though sometimes HIPAA seems complicated, it's really meant to simplify and make sort of a uniform coding system so that sharing of electronic records can happen. It applies, HIPAA applies, like I said, to electronic records, written records, and oral records. And so this is really important too, because even speaking about a case or talking about it or giving any kind of confirmation about it is also considered the oral form. And you may hear us at Open Community Health Network say this, maybe you've already heard it now, which is when you come to us for information, but we don't have that signed release, we say we can't confirm or deny that this individual is participating in services. And again, that's for their protection under HIPAA. So 42 CFR, this really, it talks about the Code of Federal Regulations. This really talks about substance use services. So I'm just going to go over this really quickly. 42 CFR governs the confidentiality of alcohol, drug treatment, and the prevention information. And really the privacy protections, they encourage individuals to seek treatment without stigma. This applies to all records relating to the identity, diagnosis, prognosis, or treatment of any individual engaged in a substance use program with us or any other qualified service organization that we contract with. Okay, so I'm going to hand it back over to Jasmine to talk a little bit more about our services.
Thank you. So let's talk about what OCHN does and what we can provide. First, I do want to mention, we talked about it briefly, but all adults in our system that are served by OCHN do need to have active Medicaid. They can be uninsured, but they must have Medicaid or be Medicaid eligible. That is for our active services. If they are uninsured or underinsured, we do provide crisis services to all of those folks. So that's an important function. So when adults come in and they are looking for services, we offer a very wide array. All of our service providers offer the same amount of services. They offer everything the same. So choosing a provider is really based on location and different personal reasons. So all of our providers offer case management. That is minimally monthly required for our services. The case manager will help support and link and coordinate the individual to other services, whether it be in the community or within our service array. We do offer psychiatry and therapy in-house. That could be individual therapy, group therapy, could be substance use disorder therapy. There's a variety of different groups that we offer. Supported employment is also another feature that we have. This will help individuals who might need some support in getting employed. They may have some barriers, and supported employment specialists can work with them in any way that they need to find employment in the community. We do offer housing assistance. That can be a variety of different things. Sometimes it's linking them to other coordinated service providers in the community. Sometimes it's assisting finding housing or with maybe first month payments or subsidies. The case manager does a lot of that coordination as well. We have what's called evidence-based practices. These are treatments that have been researched and have scientifically been proven effective over multiple studies when done with fidelity and correctly. One EBP that we do offer is ACT, or Assertive Community Treatment. This is a multidisciplinary team. It generally has a case manager, a nurse, a psychiatrist that works with that client. There are group treatment, group therapy that will be within that team. And the main goal of ACT is to keep individuals out of the hospitals and out of jail. So if someone is going in the hospital multiple times in a year, they might encourage ACT. That multidisciplinary team will come to the home. They will come out multiple days. Sometimes they can assist with medications, transportation, but really intensive services, and their caseloads are very low so that they can meet those needs. We offer MRT, which is moral recognition therapy. That's really defined as moral reasoning. It's meant for the incarcerated population, so those that are in prison or coming out of prison. It's a very structured approach. It focuses on better decision making and more appropriate behaviors in the community, and it's very structured. DBT is dialectical behavioral therapy. This will identify negative thinking patterns and push the positive behavioral changes. It's very good for treatment of suicidal ideation and behavior or self-destructive behavior, such as cutting. We do offer a variety of trauma therapies as well. Providers are trained in multiple trauma therapies, and we have a trauma-informed system of care. And finally, we also offer FCE, which is family psychoeducation. It's not up on the slide. But this is a really basic problem solving approach group. It's really, really good for the schizophrenic population in particular because it focuses on handling a problem in their life and it works through how to solve that. And it's made up of family members and other members that get to work every other week and really work through those problems. Those are a few of the evidence-based practices that we offer. There are many others as well, but these are our most popular ones. So it's important to understand how our services are determined. In the adult population, across the state of Michigan, we are required to use the LOCUS, or the Level of Care Utilization System. That is a tool that we use to determine the level of care that is medically necessary for individuals. So anyone that comes through our system is assessed. They're assessed at access and when they first start with the provider at intake, and then at ongoing intervals in their treatment depending on their needs. They get a LOCUS score based on information that they provide, and then that score is paired with their needs in the treatment planning, prison center planning process, and a level of care is recommended. It's important to understand that medical necessity piece though, because when an individual comes and says, I want such and such, we cannot just offer services because someone wants those services. It has to be medically necessary. And this tool is a very reliable way for us to determine what services might be necessary. So for example, if somebody wants their family member to live in a specialized residential home, we have to do assessments and we have to show medical necessity for that. We really, in Oakland County, we believe in the least restrictive environment, and we don't want to put someone in that highly intensive and restrictive environment unless that's absolutely what they need to be successful. We also use what's called authorization decision guidelines. So once the level of care is determined, we have benefit packages, and that is just a general sense of here are the services that are paired with that level of care. The guidelines give you an amount, scope, duration, and the case manager or the therapist, they're going to use their clinical justification to determine what is most appropriate for that person. It is person-centered, so we're going to look at their needs, their wants, their abilities, and then we're going to pair services with the frequency that they need. Sometimes we have to go back and tweak it and meet more often or less often. Sometimes we have to add services. But that level of care gives us that general benefit package, and then we do have mechanisms to go outside of that when necessary. If they need more services than are offered, we can do that, and we have an approval process that goes through. So it's important to understand there. We have a multitude of providers. On our adult side, we have 4 main providers. We have Arab American Chaldean Council, East of Michigan, CNS Healthcare, and Training and Treatment Innovation. They have a variety of locations around the county. A lot of times people choose a provider based on where they're living and how close they can be to that provider. But they all receive choice when they're eligible for services. We also have intellectual and developmental disability providers. We are going to talk about that briefly because we do find there are folks that have co-occurring developmental disabilities oftentimes that get caught up in the justice system. And so it's important to understand that we do have providers for that as well. We have more from Oakland Regional Center, and we have CLS Community Living Services. One of the things that we do in Access, which we will talk about a little bit further, is we're going to determine what the person's primary need is. So if they have a co-occurring disorder, let's say depression with autism or one of the other intellectual and developmental disabilities, maybe cognitive disorder, we're going to just determine which is primary to see which provider type they would have the best success at. So if their depression is primary over their autism, they may go to an adult provider. All of our providers are co-occurring capable. They can treat both sides, but the adult providers are really more adept at the depression piece, and the intellectual and developmental disability providers are really more adept at autism. They have different services that can really help with that. So sometimes folks won't know where they want or what they want, and that's Access's job to determine that. So if they do have an intellectual and developmental disability, and these are things that are present at birth or usually happen prior to the age of 22, that will negatively affect the trajectory of their physical, intellectual, and or emotional development. Some examples might be autism, Down syndrome, cerebral palsy. They might have a TBI or traumatic brain injury. They may have fetal alcohol syndrome. There's many more. They can have some cognitive disabilities. Their IQ score might be a little bit lower. Lots of things could be occurring. So we would determine if they're eligible for those services. For intellectual and developmental disabilities, we do have some different requirements for eligibility. We do not use a tool similar to Locus for the determination of eligibility. They must have a disability present before the age of 22. So it needs to be diagnosed prior to 22. Again, they must have Medicaid or Healthy Michigan. The disability needs to be most likely to continue indefinitely. And then we require some documentation be provided for that. The documentation that we require, and I'm not going to go into that too much, but we do need that diagnosis. We might want to know if they've had an IEP or been in special education. We're going to want to know if there's any guardianship issues. You know, are they able to speak for themselves and give us, you know, tell us what they want, or do they have a mom or there's someone that's speaking for them? So we're going to require that paperwork when they call the Access Department. We're going to ask some questions, some specific questions to get an idea of what their needs are, and then they would be screened face-to-face with my intellectual and developmental disability screener. That is actually a unique thing. Most of our screenings are over the phone, but we like to do face-to-face for this population because it's important to observe them and be able to understand what they can or cannot do. And that screening usually takes about an hour and a half to 2 hours. We do offer phone screenings for certain cases. If there's major transportation barriers, if the individual has some really significant deficits that, you know, is a problem getting out to OCHN, we can either come to them or we can do a phone screening. So those are our intellectual and developmental disability process, and I'm going to send it back over to Jody to talk about our last service.
Awesome. Thank you. So the last thing that I'm going to talk about today is our Veteran Navigator service. Our Veteran Navigator, his name is Chaka McDonald, and his job is to coordinate care and service providers for veterans and family members. He doesn't do assessments or provide clinical services, but he does provide a lot of support, and I'm going to talk about what he does real quick. So a veteran is defined as any person who served in the military for any length of time and who is discharged with any status. And this is really important because our navigator serves individuals regardless of their discharge status, whether they're honorable, dishonorable, other than honorable, general, with honorable conditions. It does not matter what the status of their discharge is. And that's a really important distinction to make because VA services, as we know, are only available to veterans and family members who had honorable discharges or general with honorable conditions, but not available to individuals who have dishonorable discharges. So Chaka, he services individuals, again, who regardless of their discharge status, he services individuals who don't meet eligibility criteria due to their time in service, meaning maybe they didn't serve a certain amount of time to make them eligible. He services individuals who are not eligible for veteran services. And honestly, he serves individuals who don't even wish to seek traditional support paths. So that's really important to remember, especially for your veterans, because of just what happens in the stigma and what happens to them in combat zones. And even when they're not deployed to combat zones, choice is really at the epicenter of what we do at OCHN, and it's part of our mission. So individuals have the right to choose their service provider, and that's based on their eligibility. But this is really important for the Veteran Navigator services for you to know, because if an individual doesn't want to go through veteran services, they can come to us. And if they're eligible for services, we could potentially help connect them with us and our providers as well. And also, CHACA, he connects with individuals even if they're out of county. So especially, obviously, for district courts here in this county, you are all servicing individuals. Well, you would send individuals to us who live in this county. That's who we service. But if you have individuals who live in other counties, they can still reach out to him. And we're going to put up his contact information in just another slide or two. And they can still connect with him because he has so many tools in his tool belt to help veterans. And I'm going to talk a little bit about what those are. So the Veteran Navigator, they provide support for military families. CHACA provides those services to family members, and that includes children and spouses. And he also provides support to organizations. So he is available, and he really does consult with a lot of organizations and entities here in Oakland County. He's really created a very veteran-friendly referral process. And he has a very strong support network for veterans here in this county and even outside of the county. He really works hand in hand with MDOC, with our providers, with the hospitals, with the courts, and of course, with Veterans Administration. So here's his contact information. And this is basically, we have a flyer, and this is sort of part of what goes out in the flyer. So you can reach him via his email address, or this main number here is our access center, and he is embedded there. And so you could call the access center and let them know you'd like to speak to CHACA. And if you can't remember his name because you don't have this at hand, you can just say, I'd like to speak to the Veteran Navigator, or you can have your individual call and say, I'd like to speak to the Veteran Navigator. So this is really important for those of you that work in the justice system to remember about CHACA and just the services that the Veteran Navigator provides. He is very, very connected to the Veterans Administration, and he has a really large knowledge base of their service offerings. He receives contacts from veterans and family members every day. So he's really valuable asset. He can be a really valuable asset to your individuals. And let's say you have individuals who say they don't want to take advantage of services. They're embarrassed. Maybe they had other than honorable discharge or dishonorable discharge. They can still reach out to CHACA. He has so many tools in his tool belt, and that is his job, is to be there for veterans, for service members, and for their families. He can also help, which is huge for a Veteran Navigator. I think especially for individuals that you have on your caseloads that are veterans or previous service members, again, regardless of their discharge status, he kind of helps ease some of that anxiety about doing things that are connected to their service. Things like trying to connect with VA to get their DD-214s or their discharge paperwork, or just reaching out to the VA for help. Maybe they've been suffering with mental health issues or substance use issues, or they are suffering from PTSD silently or alone, and they're scared or they're worried. They can reach out to CHACA, and he can really help ease some of that anxiety because he deals with the Veterans Administration every day. So I'm just going to hand it back over to Jasmine. She's going to finish us up here, and then we'll have time for questions.
Okay, so we've mentioned access a couple times. So our central access screening is kind of the starting point for everyone that would like services for OCHN. We do eligibility screening for all of our services. That includes adults, folks with intellectual and developmental disabilities, substance use disorders. We do screening. So they have to call us first to get into services. That phone number there, the 464-6363, is our main number. We have 6 referral specialists that answer calls between 8 a.m. and 5 p.m. on Tuesdays, Wednesdays, and Fridays, and 8 a.m. to 8 p.m. on Mondays and Thursdays. Individuals that are looking to be eligible for services would give information, and then we put them in a call queue where we can call them back and handle that screening. The screening usually takes 30 to 45 minutes. And from that screening, if they are eligible, we can schedule them an intake with the provider choice immediately. We do offer scheduled appointments if someone has a work issue or if they only have a certain period of time that they can answer their phone. That is absolutely fine. They just need to request that. And then we do also in-person screenings if they do walk in. We are located at the Resource and Crisis Center, which is on the county complex, but is not the court building. It's building 32 East. We are in the same building with Common Ground, which most people do know of. You can walk in, and if you'd like to have an eligibility screening, we would do that if we have a screener available. We have one screener that handles that, and she's excellent. But if you're worried about a time crunch, I do recommend calling, so you don't have to sit for them. Yes, question.
We do have a access-specific webinar coming up. I did put in the chat a link to where you guys could register for our additional webinars. This is the first of 4 in a series. And the access-specific webinar will be on May 8th at 10:30 as well. So that link will be in the chat.
So another resource we have that is also in the Resource and Crisis Center is called the RISE Center. We use the RISE Center every day. This is a free community resource. The individual does not have to have Medicaid, does not have to be uninsured. It can be anyone that is in Oakland County. They can walk in or they can call. We have case managers on hand to support them in employment, housing, if they need to apply for Medicaid or Social Security. They do that all day long. You can call, you can schedule an appointment, or you can just walk in. And again, it's in the same building as Common Ground and Access, called the RISE Center, and information is right here. I just want to briefly go over Common Ground because I know that this is a name that's out in the community. And it's important to note that Common Ground and OCHN are different entities. Common Ground is a provider of OCHN, it's our crisis provider. They provide crisis services for all the folks with Medicaid or no insurance, and they also provide substance use disorder services for the folks in Oakland County as well. They have a crisis line. The number is right there. You can call it anytime you're feeling in crisis, anytime there's a risk of anything. They will walk you through that and help you through that crisis. They have, they are the crisis screening unit called Oasis. Anyone that is feeling like they need to be hospitalized or concerned, they would go to Common Ground, and Oasis would do an assessment and crisis intervention. They determine and authorize inpatient care. If an individual is not qualified for inpatient care, they would provide crisis intervention and link them to either providers or other services. They have OCRT, which is the Oakland Crisis Intervention and Recovery Team. That's a mobile crisis unit. OCRT is often sent out to emergency rooms when our individuals are there. They can help people. They're kind of a bridge service between the crisis and then opening up with the provider. So they can help assist, get them where they need to go, work with them until they're stabilized. And I believe it's up to 30 days that they can work with someone. They have a victims assistance program. So anyone that is struggling with any type of situation where they were a victim, they have groups that they offer. They also have a crisis response unit, or the CRU. This is similar to inpatient care, but it's a voluntary program. It's right on site at the Resource and Crisis Center. And it's kind of, you know, it's not a locked unit. Individuals have to want to be there. It is not something that you can send them without their consent. There is also a legal clinic they offer, and then the sober support unit. We're going to talk more about substance use disorders in the upcoming webinars. But this would be for anyone that is struggling with substance use disorders. They're in immediate crisis. Maybe they need to go into residential and they can't get there immediately, or access might be closed. They walk right into Common Ground and they can put you on the unit and link you to those services. One other thing that OCHN offers is our customer service line. The phone number is at the bottom. Customer services is really a problem. You can call them for lots of different issues. You can call them if you're in services, or if you have a problem with services. They can reconnect you if you were discharged in the last year. They can help navigate the system if there's questions, if there's problem solving, if the individual doesn't like their case manager, or there's a problem with the provider. And then they can also give resources and community services. Access and customer service work very closely together. You can also call access for some of these things, and we will get you to the appropriate person, whether it's us or customer services. But this is just another outlet for if there's concerns or if there's a problem, they can help us with that. And that wraps up our discussion point of the webinar.
We want to open it up for questions. If you guys want to open up your chat. And if you have any questions regarding this presentation, I did send out the link regarding the upcoming webinar. The substance use disorder services, an overview of that will be on March 27th. We have juvenile specific services on April 10th, and then the access on May 8th. And again, all of these will be recorded and available on our website. You will receive an email from me within the next week with a link to that archived webinar, along with copies of the PowerPoint slides so that you have access to this information as well. We do have one question here from Carol. If a person has Medicaid and needs mental health treatment, they must go through OCHM providers, or do private providers also accept Medicaid?
We do have private providers that accept Medicaid. The OCHM providers are for very severe and persistently mentally ill folks. So anyone that just needs, therapy once a month or every other week, they're welcome to call, the numbers on the back of their Medicaid card. There's a ton of providers in Oakland County. But if they're really looking for case management and psychiatry and some of those specialty services, then they would need to call access and get us treatment.
Great question, Carol. Does anybody else have any other additional questions? While we give it a few minutes, I did put a link in there to an upcoming trauma training that we have for criminal justice professionals. We just had our first one last week, and this really talks about how to be trauma informed in a criminal justice setting. So I know a few of you that are on this webinar attended that, and we are having another one on April 13th for that. I also put in a couple links for information on HIPAA and 42 CFR as well. So we'll leave it open if we have any additional questions or comments or anything like that. You do have our main number right there, along with Jody's information, who, for those of you who are in probation and parole in the court system, will be your direct contact. You also have my contact information regarding anything training and education with OCHM. So with that, any comments from our presenter?
Yeah, I would just like to say, Jody here, that I am still the liaison for probation and parole, like Tricia said, and community corrections. And really anybody can reach out to me. My title is Probation Mental Health System Liaison, but you can always reach out to me with questions, concerns, any kind of issues. And if it isn't in my wheelhouse or it has to do with a substance use issue, I will hand it over to our substance use department, or I will hand it off to whoever needs to have it handed off to. And a lot of times I get contacts for individuals who just logistically it wasn't possible to have a release of information signed, and that's okay. You can still contact me even if that release of information isn't in place. Of course, we would like it to be, and that would make communication a little bit smoother and easier. But if you don't have that and it just wasn't possible to get it, you can still reach out to me, and we will still always try to help connect the entities that need to be connected. If you need to get a probation report or a compliance report from an individual's therapist or case manager, we will always work behind the scenes. I will always work behind the scenes to try and get you what you need. So please always continue to contact me with those kinds of questions, concerns, or issues.
All right. Well, thank you everybody for attending. See you later. Bye.